This is the left kidney frozen on the ultrasound, that of a 22 years old male. This is the longitudinal section, and it measures 13.7 centimeters in length and 6.25 centimeters in anterior-posterior diameter. Now the length is increased as well as the anterior-posterior diameter is raised because 11 centimeter is normal for the length. Patient's kidney length is 13.7, and the most important one is the anterior-posterior diameter that does not change with racial differences or the height of the patient. So this is 6.2, that of the patient, whereas the anterior-posterior diameter exceeding 5 centimeters is considered enlargement. So this is the first thing to be noted in this frozen image. Now you see this tiny tubular structure is the arcuate vessel, and this is the pyramid. This is the cortex of the kidney. Cortex measures 8.8 mm and is with a normal. Now if I include cortex as well as the pyramid together and take the measurement, it will be the measurement of the parenchyma in total, which measures 21 mm. So both are within normal. The cortex as well as the pyramid, and corticomedullary differentiation we can say is intact, and that thereby the kidney is functioning, we can say, normally. Second thing to note is that you are seeing cystic areas all over, from lower to the upper pole. These are the upper pole dilated calyces. This is the upper pole dilated callus, mid-region dilated callus, lower pole dilated callus, lower pole dilated callus. This is the pelvis of the kidney, and we can see the central sinus echogenic complex fat as well in the mid-region only in this patient. Another thing is that we see longitudinal tubular structure in the dilated proximal ureter entering into the calyces. Now you see this shadow is that of the stent that has been placed. This is also a shadow of the stent that has been placed in this gentleman for obstructive uropathy to relieve the obstruction. And the stent is patent as is in front of you. This is also a part of the stent, this area. Now when I apply then you can see that the kidney is being perfused up to the parenchyma is being perfused at all levels. This is the parenchyma. These are the arcuate vessel artery, and here you see we do see blood supply to all of the renal parenchyma. At the hilar region, we do see patent artery and vein. Yeah. This is the, I'm sorry, this is the renal artery, this is the left renal vein, and see these two linear structures seen are the, in fact, is the stent. This is the stent placed. And beta sadara rope, मैं कमांगा रोक लेना सारो. Now, because of this placement of the stent, this is a very much normal study that of the renal artery. This is the waveform of the renal artery. No. And the renal artery. Renal artery shows the resistive index of 0.55 with which is normal, and the waveform is normal, whereas this blue line that you are seeing, this blue area is that of the consistent with the venous part. This is also the vein, and the venous pressure is on minus 19.1. So anyways, the kidney is being perfused normally. The corticomedullary differentiation is intact. You see this, from here it seems as if this is a full multicystic kidney, but the cyst, when I give let's see, for study purpose, these two cysts appear as, these two cystic areas appear as cysts, but when I move the probe, angle the probe, it becomes tubular, they are non-communicating, and so this is a case of obstructive uropathy with stent placed, normal. See, this is the pyramid again, a normal intact corticomedullary differentiation, normal parenchymal thickness with the stent seen placed within. We can see the stent in the proximal ureter running into the pelvis and then the kidney. See there. So the stent is patent. You see a patent stent. Now here, this is the urinary bladder, and we can very well see the. Now this is the. There are two areas to be studied in this case. This is the dilated distal ureter left side, 13.1 up to 7 is normal. This is the prostate, and here if you concentrate, you will see two tubular structures. See, this is the dilated distal left ureter, and this tubular structure, this area is the stent, and this tubular area within the lumen of the urinary bladder, as this is the urinary bladder, is the stent, and it is patent again. It's important to say. Here you see the stent. This is the stent. This area is the patent stent, and now just a bird's eye view from that of the right kidney, which is all normal by all parameters. So this is our case of the day. Thank you very much.